Have you ever received medical test results that felt like a secret code, full of numbers and terms that left you scratching your head? When it comes to understanding your bone health, especially after a bone mineral density scan, two terms often pop up: T-scores and Z-scores. T-scores and Z-scores are numerical values used by your doctor to interpret the results of your bone mineral density test, often called a DEXA scan. They help assess the strength of your bones and determine your risk for osteoporosis and fractures. The T-score is the primary measure used to diagnose osteoporosis in adults. It compares your bone mineral density to the average peak bone mineral density of a healthy young adult of the same sex. This comparison helps determine if your bone density is significantly lower than what is considered optimal for strong bones. A T-score of -1.0 or above is considered normal, indicating healthy bone density. A T-score between -1.0 and -2.5 suggests osteopenia, which means you have lower than normal bone density, but it is not yet osteoporosis. A T-score of -2.5 or lower indicates osteoporosis, signifying significantly weakened bones and an increased risk of fractures. On the other hand, the Z-score is primarily used for individuals whose bone density is still developing or when other factors might influence bone health. This includes children, premenopausal women, and men under the age of 50. The Z-score compares your bone mineral density to the average bone mineral density of someone of the same age, sex, and ethnic background. A Z-score of -2.0 or lower can indicate that something other than normal aging might be causing your bone density to be lower than expected, such as an underlying medical condition or medication. Understanding these scores empowers you to have a more informed conversation with your healthcare provider. Your doctor will look at your T-score or Z-score alongside your medical history, lifestyle, and other risk factors to provide a comprehensive assessment of your bone health. This information helps them recommend appropriate preventative measures or treatment plans, such as dietary changes, exercise programs, or medication, tailored to your specific needs. These scores are essentially a snapshot of your bone health, allowing your doctor to track changes over time and evaluate the effectiveness of any interventions. They are a critical tool in preventing fractures and maintaining your mobility and independence as you age. Knowing what your T-score or Z-score means is a vital step in taking proactive control of your long-term bone health.